Everyone. Today the topic of discussion will be infantile evening colic. This is also called infantile colic or 3-month colic and is one of the common condition which is seen in infants who are previously healthy and is characterized by episodes of inconsolable cry which creates stress to the family. This is functional gastrointestinal disorder. So the feature is recurrent excessive inconsolable crying episodes in the healthy infant, and the peak age is at 6 weeks. It can start at around 1 to 2 weeks and gradually resolves by 3 to 4 months. Commonly occurs in the late afternoon or evening. There is rule of 3 or criteria of whistles which gives the diagnosis. So according to this criteria, number 1, crying duration, that should be more than 3 hours per day. Number 2, crying frequency should be more than 3 days per week, and crying period should last over more than 3 weeks. So with these criteria, you can suspect this child is having evening colic or the infantile colic. Etiology is multifactorial. It can be due to gastrointestinal discomfort from gas and aerophagy. Overstimulated or anxious parents can affect the sensitivity of the infant and then they manifest with the colic. It can be due to hunger, improper feeding or cow's milk protein allergy. Physiological immature nervous system and congenital hypotonicity of the infant may also contribute to this condition. Diagnosis of the colic. It is diagnosed clinically by history and physical examination. So here the cry is loud, high-pitched and associated with clenched fist, legs drawn to abdomen, clenched fist, legs are drawn to the abdomen, and then face is flushed. But before diagnosing or saying this is a colic, you have to rule out the organic causes. The organic causes can be GERD, that is gastroesophageal reflux disease, can be intussusception, or maybe some infections like urinary tract infection or otitis media. So after ruling out the pathological cause, then you can say this is a colic. Treatment approach. Parental reassurance is a main modality of the treatment because this is a self-limiting condition. So parental education is always very important. They are very overstressed because of the child crying continuously for 2 to 3 hours. So the reassurance will be very, very important. Then there are certain soothing techniques you can teach the parents. The techniques can be hold the baby erect or prone position, that will relieve the colic a bit, and feed in upright position, burp after feeding. So burping is, that is taking out the gas after feeding. Then you can do some feeding adjustments like avoid overfeeding and use lateral or prone positions. And then medication has very minimal role. Use antispasmodic medications only if it is needed, and that should be under medical supervision. Many times medication is not required, just the soothing techniques and feeding adjustment is going to help the baby. Now the key takeaway message for this condition is infantile colic resolves by 3 to 4 months without long-term harm. It does not carry any sequelae. So it is very benign condition. You have to counsel this to the parents. Then parental education and support are essential component of this management. Diagnosis is clinical, but always rule out the other causes. And conservative soothing methods are the first line treatment modalities. Medications are very rarely used. If you use, you should use cautiously. Thank you. So next class again I'll come up with some other behavioral disorder of the children. If you find this lecture helpful, please like, subscribe and share so that you don't miss the next class. Thank you.